Hello, welcome to my presentation regarding the Beck Inventory Assessment. In this PowerPoint presentation, we will uncover information regarding history of depression, depression and social anxiety, depression and obesity, the overview of the Beck Depression Inventory, also known as BDI. Depression and anxiety has always been a concerning factor among psychiatric practice for many reasons. As it continues to become a social and public health concern, further research is necessary to debunk conflicting theories as it relates to particular symptoms, where although anxiety and depression are distinct, both have related symptoms. Adolescents facing a number of symptoms to include social anxiety will also experience intense fears, avoidance, rejection that may lead to depression. In particular situations, social anxiety has a lifetime prevalence rate of 13% and a 12-month prevalence rate of 7.4% among adolescents 13 years and older. If left untreated, it will continue well into adulthood, and more importantly, evidence shows that social anxiety starts in earlier years and continues on towards adulthood. In addition to social anxiety, symptoms of depression has been known to correlate or cause symptoms leading to obesity. For example, on a nationwide scale, combined symptoms of obesity and depressive disorder are between 18.6% to 24.1%. Here we have a few of the symptoms, such as sleep disturbance, weight gain, and more importantly, an increase of appetite, all of which may lead to obesity. Globally, obesity among individuals or adolescents causes various health complications such as hypertension, heart disease, and increase in mortality. Further studies are now warranted to revisit the approach, proving obesity may also lead to depression. Among these prevailing symptoms, body dissatisfaction is especially common occurrence among individuals in psychosocial distress. Realizing that ED, which stands for eating disorder, psychopathology, combined with psychosocial problems, it is necessary to treat each independently. The ED, or eating disorder psychopathology, includes severe dietary restriction, self-induced vomiting, binge eating, to name a few examples, and dissatisfaction that may differ in their relationships with various aspects of psychosocial functioning. Here we will also discuss an overview of the Beck's Depression Inventory known as the BDI. There are highlights that I've listed here. For example, the BDI, or the Beck's Depression Inventory, was invented in 1961. It is a 21-item self-report scale in both clinical and research studies. It's also used on individuals 13 years and older. It, more importantly, corresponds to the criteria for diagnosing listed in the APA, and the self-reported questionnaires focus on cognitive disorders and depression. In elaborating further, the Beck's Depression Inventory, or BDI, correlates with APA, DSM-4 diagnostic criteria, and here are just a few examples: increase or decrease in appetite, hyposomnia, change in body image, thoughts of suicide, etc. The approach here, or the approach with the BDI inventory, describes symptoms of depression utilizing a combination of patient symptoms and formats. These effective measures provide a snapshot of their current systems. The BDI has been noted for the quality of the soundness in terms of consistent format, well written, thorough, and providing information for the reader to understand. It also provides uniformity for test administrators and advising examiners, and also a consistent administration process. Overall, the BDI has proven to be a reliable tool in assessing the symptoms of depression. Although research has proved that there are such advantages, one where clients may alter their responses based on their personal agenda associated with depression. And in such cases, it does not provide a resolution to appropriately handle the cases with an altered results, rather applying ambiguity. Here we have an example where the selected participants were asked to fill out a self-reported questionnaire. The goal, or the aim, was to determine the differences in individuals with symptoms of MDD. In this situation, the aim of the entire study was to examine the correlation between depression symptoms before and after treatment. Overall, the BDI showed consistent results to have content validity in determining the differences between depressed and non-depressed individuals, and that was very important. Although there are some limitations that has been notable, such as bias influence to their responses and demographic factors and personality traits that also should be considered in future trials. Moreover, sample size plays a considered factor as well in determining significant changes. Here we are at the end of my presentation, and I just wanted to thank everyone and joining me here. The aim of the presentation is to demonstrate the effectiveness of the Beck Depression inventory, especially with individuals and adolescents with symptoms of depression and obesity. It has been proven that the BDI is more effective in determining comorbidity. We do have limitations in place. However, more research is needed to improve in those areas where bias is present. And in many circumstances, utilizing the BDI also may encourage individuals to change their responses based on personal interest. Nevertheless, the BDI has overall proved to be an effective tool in determining depression among individuals and some correlation with obesity.